Good morning, friends. April here with Medwell Health and Wellness. Happy Thursday. It's Emily and I's favorite day of the week. Hey, Emily, how are you?
Good morning.
Good morning. So, my friends, I was thinking actually last night, Emily, about we started in kind of the end of September and like we have lives scheduled through December, but I'm like, gosh, we're at the end of the year already. Like we've been through
I
so
know. I know. It's crazy. Like, where did the time go?
Yes.
I know. We've been so fortunate to have these amazing folks on our Unscripted, though. I look forward to Thursday every week.
Yes, myself included. All right, my friends, we have a great chat today in store. We have our friend Marion Mcnabb, who is the president of the Cannabis Center of Excellence, and she's going to share about her nonprofit organization and all of the phenomenal stuff they're doing in the community with veterans and medical cannabis. And it's if you love data, today is a great day to be checking in with us. So some housekeeping, friends. We are streaming live. So with live, there can come some technical difficulties. So if we bleep off for half a second, one of us does, don't go anywhere because we'll be back. Please do leave a comment or question if you're catching the replay. I know we have a lot of friends that always catch the replay. So please do leave a question or comment. We will absolutely get back to you. So let's get started, my friends here. So Emily, I'm going to start with you because Emily's been out in the community and I looked at the schedule for the next week yesterday and I was like, oh, this busy gal. So tell everybody where you're going to be in the next week.
I'm busy and I'm keeping you busy, April. So yes, I'll be out and about in the community. You'll find me at your local dispensary. I'll have a table there. I love being able to speak to patients and non-patients alike. So if you see me, make sure that you stop over and say hello. It's always an absolute pleasure to be able to answer anyone's questions that they may have about the medical program here in Massachusetts. And definitely, if you're thinking about it, please make sure you just pop over. It's just like I mentioned, it's always an absolute pleasure to be able to say hello and talk to folks out there. So you'll certainly see me and check our calendar and all of our social because I am a busy gal over the next few months.
You are for sure. Awesome. All right. So, my friends, I'm going to introduce to you Marion Mcnabb. She's the president of the Cannabis Center of Excellence. Today, she's going to share about her organization, population studies, and programs. She's also going to share a lot about kind of the research and the stats. And she does have some interesting metrics to share with us today. So, Marion, I'm going to let you take it away because you're going to tell a lot better intro than I am about yourself and all of your vast experience. And I do know that you are a face in the community, so you're a very familiar face, which I love that. So I'm sure people here today watching or catching the replay will be like, hey, I know her.
You're very sweet. Thank you so much for the kind introduction. And I'm really honored and excited to be here. Can you hear me okay?
Can hear you great.
Okay, awesome. Yeah. Hey, everybody. So yeah, thank you for the introduction. So my name is Marion Mcnabb. I'm the president of the Cannabis Center of Excellence. The Cannabis Center of Excellence was an idea that was born actually 6 years ago this week. And it was a competition that my colleague and I attended at Boston University. It was an ancillary cannabis startup competition 6 years ago. And it was for BU alum students or faculty to apply for a startup for an ancillary business. So we pitched to create a virtual cannabis center of excellence, which would bring together academics, industry, policymakers, consumers, patients, and healthcare providers, and laboratories and scientists together to kind of advance the science and research around cannabis. So that was 6 years ago. Wow. We ended up winning that first Boston University Cannabis Startup Competition, which was really exciting. And I was able to attend that competition this week, actually, for the 6th round of people competing. So we won that competition. And right after that, under the guidance of the School of Business at BU, as well as others in the industry, we started out as Cannabis Community Care and Research Network. And we started conducting educational events 6 years ago. And then a group reached out from UMass Dartmouth and decided, and we met for quite a number of months and decided that we would form a partnership to conduct cannabis research studies that would be focused in Massachusetts, but also nationwide. So back in 2018, we started with the first of what is now 7 different research studies that I've been the principal investigator of, and which
Wow.
when I looked at it this year, I was like, or this week when I was presenting, I was like, wow, that's a study a year. Very exciting though, and very important work that's been done. So the first study was a cannabis consumer and a patient study, and that was back in 2018. And we ran several different educational events in Massachusetts surrounding that study, 6 to be exact. And what we learned in that first research study was really trying to understand, why do people consume cannabis, both from a medical and an adult use perspective? What health conditions are they facing? Why are they seeking this relief? How much are they taking? What do they like to take? How do they like to take it? How long have they been consuming? Where do they find their information about medical cannabis or adult use? And then what access and barriers, might, they have. So we found some very interesting findings. You can find them published in an SSRN paper. I can put the link here in the chat in a minute. But what we found was, interestingly, over 50% of the sample was using cannabis to reduce some kind of unwanted prescription or over-the-counter medication. And the reasons that people were consuming cannabis were across the board: chronic pain, anxiety, depression, PTSD, everything down to, menstrual pains. Even people with diabetes, facing diabetes, reporting using cannabis and having it benefit. So that was back in 2018. So piqued a lot of my interest. And I'm a public health doctor by training. So I'm used to conducting population level research studies, but also implementing programs that really drive change. So when I saw this data point, as cannabis is a non-lethal alternative compared to some of these other more harmful, potentially more harmful or lethal medications, from a public health perspective, to me, it was an emergency. An emergency to get the word out, to try and understand what this is more, because it is legal and this is a legal substance. And so, based on some of those results, a leading veteran advocate in Massachusetts reached out and said, you know what, this might apply to the veteran population. I said, absolutely. My brother's a veteran. My father's a veteran. My brother's actively trying to get back into the service. I was like, absolutely. So in 2019, we launched the Veterans Health and Medical Cannabis Survey, which asked similar questions, but used very specific question sets and data points that were specific for veterans. Mainly how the VA captures care and recognizes diseases and symptoms. We wanted to integrate because we wanted the findings to be able to resonate with the VA, since veterans are, it's a whole different kind of health system, and veterans face disproportionate, service history and disproportionate, health conditions and symptoms based on their service. So we ran that study, and these are all studies together with UMass Dartmouth, approved in their IRB, and ran 6 events out of that as well. And what we found was 76% of the veterans were using cannabis as an alternative.
Wow.
And we also learned, and more recently, as I've been writing up these results, and very excited that these results actually have just been submitted on October 31st for peer review publication. So it's in the peer review process. So we'll have an article coming out as part of a joint peer review publication with the Cannabis Control Commission. So they're very excited about the veterans study and the publication. And so, with what I found was, veterans are often taking way more medications, PON medications, sometimes than the general civilian population. So it's a very important group for us to look at, a very vulnerable group. And we found that the largest barriers to access for veterans in that time period, in 2019, was cost. A lot of these veterans are disabled. Some people are unable to work. So cost to access the medicine, cost to access the medical card were all barriers. So fast forward, I'm almost done. Fast forward a couple years. Fast forward a couple years. Now we're in 2022. Did conduct a couple of other studies in the meantime, but pressingly, earlier this year, part of the research approach that I've taken is a citizen science engagement approach. So a lot of researchers will typically survey groups and then spend about a year to write it up in manuscript, and then it takes about maybe another year for it to get to peer review. So by the time the word is out, it might be outdated, the data or the relevant findings. So when I started this work, we employed an approach called the Cannabis Citizen Scientist. It's part of our first publication, where when we asked people, veterans or the consumers or patients, to fill out the survey, we're sharing this information back with them because we want to engage with them. We want them to be able to see that they're not alone in this. Cannabis can be very stigmatizing. Still, people can be stigmatized around it. So we wanted to create that community and awareness. And we did that through these educational events, inviting people who submitted their answers to watch our results online or to read the publications. But it also formed what we now run as our current research study at the Cannabis Center of Excellence, a program called I Count. So it's I and then count. And there's a reason why we chose that name, I Count. We want to empower a cannabis consumer or a patient or a veteran to realize that they do count and that their voice and their opinion when they share that in research or in clinical care matters. And not only that it matters that they share it, but they can receive information back and be part of a citizen science approach. So the platform called I Count launched earlier this year for cannabis consumers and patients. And the idea is to link cannabis, CBD, hemp, and ancillary business brands together with cannabis consumers, patients, and now veterans to conduct research studies and educational programs that are tailored to those needs and that really work to bring community together. So most recently, we focused on the I Count for Veterans platform, and we have 2 research studies going on right now, and excited to launch 2 more this week in advance of Veterans Day. So we'll have 4 ongoing studies for veterans. And these basically, how it works is a veteran can enroll in I Count and they take an intake survey. And then once they've completed that intake survey, they can access any research study that we bring on. And the goal of our studies is to increase access for veterans. And that was all based on the results of our first study. Again, I'm a implementation learning type researcher. I like to collect data, learn something, design something else that's in response to that. So,
Marion, can I just ask you a question?
Sure.
I don't mean to interrupt you, I guess. So I'm curious how you find kind of the veterans to take your survey. So
I was thinking the same thing.
Yeah. So like, obviously I know, we have all these great platforms, but like, and I know that you're at events, but like, how do you actually get that data in the hands of the people that can give you that feedback?
Right.
Yeah, it's a great question. For our current project, we partner with a group called Patriots Helping Vets. They're based out of Cape Cod, Massachusetts, and they're a very grassroots veteran organization that has really grown nationwide significantly in the last year and a half. And they'll be at the Harvest Cup this weekend. We'll have our tables right next to each other. And they have a big social community where they support veterans with cannabis, with teaching them how to grow, with FECO, all sorts of great tips and veteran support groups. So they're our partner in this project. So they help get the word out to veterans. We are also in the process where we would love to work with any veteran organization or any organization that wants to support veterans or get the word out for veterans. So, we did just launch this around August this year. We're in October. So as we get going, we've trying to reach out to other major groups and local groups in Massachusetts, but also national groups. In 2019, we partnered with Disabled American Veterans with that study, and they helped get the word out. So any kind of veteran group that wants to participate or support, we would love to work with you, and we would love to be able to try and also hustle up some donations to make sure that, we can all participate.
Absolutely. That's
awesome.
great.
Awesome. So, I guess one of the things, so when you're when you're reporting this data, and what is your goal of like, who is it to get the hands of to make that difference, right? Because you're a nonprofit, obviously you're putting a lot of time and energy and a lot of time into reaching and kind of making change. But like, what is the end goal of this analytics? Who are we trying to get this in front of to make a difference?
Yeah, that's a really great question. So, for me, it's a couple of goals. There's one, the goal of the veteran themselves, and the consumer and the patient. I feel like there's a lot of education and information that they still need, and it comes trusted when it's part of a research study. Same with a healthcare provider. They're really going to be focused on relying on peer-reviewed publications and data to be able to say, okay, clinically, this has been proven and I will integrate this into my practice. So that's why we go the peer-reviewed publication route, because we want to make that long-term institutional change. But we also are very interested in, like I said, the moving quickly. So actually, last year, I was appointed to the Massachusetts Cannabis Advisory Board. It's a 25-member advisory board that advises the Cannabis Control Commission on various areas. Yeah, thank you. I serve in the retail position, and in the last couple of months, the Cannabis Control Commission nominated me to be the chair of the research subcommittee. So how I'm using data now is trying to drive policy change at that level. So how do we change the program? How do we change regulations? What state laws do we need to have? Is this, a regulatory or a legislative fix? And how do we help the Commonwealth move the dial forward? So how we've done that with the veterans data is in this committee, the subcommittee, that was one of the first topics. Veterans have kind of been overlooked in Massachusetts. There's not a veteran representative on the Cannabis Advisory Board. Veteran-owned businesses, could use a little bit more support to have more ownership in the industry. But then also just generally like programs for access. I mean, our state is way behind other states. So what we did as our first task was take some of the findings from not only the study that I've conducted, but other studies, other states' examples of what veterans programs could look like. And we've run it through our monthly meetings, and we're actually voting on them this month on November 21st, our recommendations to improve veterans access. So we're using data from policy levels down to peer-reviewed publication. And then the other way I present data is at places such as the Harvest Cup this weekend or NECAN. And oftentimes those are for, consumers, patients, but also business owners and investors. Because I think it's important for those groups, everybody, the whole industry, to understand, what these findings are. And they're critical for preserving the credibility of an industry, and making sure that in this new growing industry, there's public trust around cannabis, and there's a way to introduce this that is evidence-based and not just marketing-based. Does that make sense?
It does. Marion, do you ever find that some of the veterans are, I'm sure that everything is completely, I would imagine, along the lines of being HIPAA compliant, or their answers are strictly confidential. But is there any sort of nervousness about the VA and that association? And I know just from me speaking to veterans, since I've been here at Medwell, that there is a little bit of some pushback with that, since federally we're still under that illegal umbrella.
Yes, and we are. We do have a privacy statement that's actually about to come out. We're going to give it to all veterans to ensure that their data and their information is squarely safe with us and under IRB approval. We have all of that coming out, so stay tuned for that. But yes, many veterans are hesitant even to get a medical card because they don't want the VA to know. But in effect, the VA cannot actually remove their benefits if they're a medical cannabis card holder. But a lot of veterans don't know that, right? So I was just in a dispensary the other day, who's one of our veteran study partners. We work with Gibby's Garden as they're providing a retail study bundle for veterans in 4 outlets in Massachusetts. And I was at the vault, and I was, thanking the retail partner and kind of looking at the study bundle and taking pictures. And it just so happened that a veteran was next to me buying cannabis. And this was at an adult use dispensary. And the veteran, and I said, okay, well, please join this study. Here's what these products are, and you'll report on its impact, and you're contributing to the community. And he was interested, but he told me the whole reason he went to adult use was because he didn't want to get a medical card because he was afraid of the VA. The other challenge for veterans is owning a firearm and then having a medical card.
Right.
But the benefits of being a medical card holder, no tax, you get discounts.
Right.
I mean, there's so many more benefits.
Right.
And if we could just explain or give even like a piece of paper to a veteran that says they can walk in and knows their rights. You know what I mean? That might be a good tool to help.
Yeah.
I mean, do you see that too? I mean, does that kind of resonate with what you
Absolutely. See? Yeah. And that's why on Unscripted, we did have our chief of police, Carmichael, who I'm sure you're familiar with.
He sits on the committee.
I was just going to say he's on the committee, and we had him explain how that it is not a factor here in Massachusetts with a firearm in your medical cannabis card. And I've sent that video to multiple folks throughout the years so that they can understand that's not going to be something that will be a factor for them. Ultimately, though, I understand that many veterans, listen, they have their reasons and they need to be comfortable with it. So I completely get it. But then I also explain how, as well, getting a medical card, it's not like you're on a list or anyone will know or anything like that. It's not like it'll be reported to, their primary or anyone at the VA. But again, it's just a matter of just needing to feel comfortable. But it would save just so much money for them throughout the course of the year to not have to pay taxes.
Yeah. And I mean, veterans, a lot of them are disabled. A lot of, some of them are 100% disabled, like fixed incomes, live in veterans' homes.
Sure.
So there's that limitation too, there's a high homelessness rate. And unfortunately, that the 22 suicides a day is now more than 22 suicides a day. And that's why it's an emergency that we really kind of really provide some non-lethal, legal alternatives to this population. Like
absolutely.
It's incredibly important.
Continuing that education, I think, and getting that in the proper hands.
So where is the best way for people to, sorry, I have to block somebody. We have a little explicit stuff going on YouTube.
Spicing up Thursday.
YouTube is known for that. It's awesome. Yeah, you never know what you're going to get. The good news is we're not talking about herpes today because we have one that just everywhere we went, it was like herpes. But anyway.
Oh man, I used to work in HIV and STI, so very familiar with herpes, and used to teach education programs around it. But today we're talking cannabis.
Yeah. Right. Actually, it was somebody saying there was a testimonial how medical cannabis helped their herpes. Like
interesting.
Yeah.
Interesting.
It was not a real profile, but anyways. So what's the best way for people to connect with you, especially at the end of the year? Like we're in that kind of Giving Tuesdays coming up in December. What is, and this is actually like Emily was saying earlier. Friends at organizations, like a lot of the veterans organizations, because of federal funding, sometimes can't work with your organization. So, but you have the ability to really get your messaging out there, and businesses in the medical cannabis industry can really support you on this. So what's the best way for them to reach out to you and, make a nice donation as we approach the end of the year?
Thank you. We would appreciate any donations. We are a small nonprofit that does a lot of really good work, but doesn't have a lot of grant funding opportunities available yet for medical cannabis groups like myself. So any kind of donation, we very much appreciate. Any work that's donated for our veterans work, we share with Patriots Helping Vets to help run this program with iCount. Companies can sign up for iCount if they're interested in donating to help us keep going and growing. They can also work with us to create a study bundle product. So we work with Gibby's Garden and Good Chemistry right now, and they're offering products for veterans that the veteran can evaluate on. So if partners are interested in that and interested in helping in that way, where they're providing access and getting data back, we have those kinds of opportunities available. We also do custom study partnerships. So with other products, currently working with a product called Undo, which if you overconsume cannabis, you can take it and reduce your tolerance reduce your return to mental clarity within 20 minutes.
Oh,
You can
wow.
also reduce your THC tolerance while consuming cannabis over 5 days.
Wow.
Wow.
Great.
Interesting.
Yeah, yeah. So that's what all these boxes are behind me. We have study bottles of Undo. 33 have been mailed out this morning to veterans, so they get 3 bottles, and it's a free product. It's a $50 worth of product that the veteran gets. So,
Wow.
that's not a cannabis product, but still something that's valuable. And then excited to bring on 2 new partners, which will be Good Chemistry. And then Green Lion Partners is going to provide vape devices for veterans to evaluate.
Nice.
So,
Well, that's
yeah. So if companies want to offer, education programs or discounts and then have engagement, we are open to that. But we also accept general donations. And I will give a plug about what our forthcoming 2023 focus will be if companies are interested. We're very much aggressively developing a plan to research and explore how medical cannabis can play a role in addressing the opioid epidemic as a harm reduction alternative.
Oh, yeah.
Veterans will be one group, but we're going to try and look much larger. So we have a lot of proposals that are being written right now. So if companies are interested in supporting this, we've got a few companies interested. We'd like to get a consortium because I think it can really make a difference based on the last 6 years of data I've collected.
Yeah, that's a crucial one.
Yeah.
And then on an individual basis, people can also join you on Patreon, correct?
Yes, correct. So we do have a Patreon account. We publish weekly data roundups. So we have a lot of our data on there that you can access, some articles, and we'll be publishing more on there. So yeah, we have different Patreon member levels. Thank you for that. And if people are interested in donating, they can go to the CannabisCenterofExcellence.org. Thank you for putting it in the chat. And you could see ways to sign up and donate there as well, and learn more about our research studies and programs. You can also email me directly at marion@CannabisCenterofExcellence.org. And we would be extraordinarily grateful for any support and partnership companies wanted to provide.
Awesome. So Marion, thank you so much for all that you're doing for, with the data and the research and especially all that you're doing to help veterans, especially as we honor our veterans this week. It's very poignant that we're speaking to you. Right. So, and thank your family for all of their service. And
yes, for sure.
My dad's birthday is tomorrow on Veterans Day.
Oh, wow. That's amazing.
That's great.
Amazing.
Yeah.
So, and one last thing, you are going to be at the Cannabis Cup this weekend. Is that where you're
Harvest
going to be?
Cup.
Harvest
Yep.
Cup.
Yep, the Harvest Cup. So I'll be there this weekend. We'll have a booth. So you can catch me Saturday and Sunday. I'll try and lock myself to the booth. And we'll be right next to our partner, Patriots Helping Vets. So you can learn more about the 4 studies ongoing. Sign up if you're a company or if you're a veteran. We'll be there. We'll have really cool new stickers. So
that's great. Yeah. That's always a super fun event. So definitely if you're around this weekend, certainly make sure you check it out. That's a really good one.
Yeah. And I'll give a plug for another event that the Cannabis Center of Excellence is co-hosting with MCR Labs on December 3rd, which is the second annual Cannabis Science Fair.
Oh,
so
we're big fans of MCR Lab over here at Medwell. So that should be a fantastic event.
Yeah. It'll be our second year doing it. We did it at Boston University last year at the Build Lab. And this year it's going to be at Harvard University. So we're going to have around 20 science exhibitors, posters, some speakers.
Fantastic.
Yeah, it'll be really fun just to explore local cannabis research and science.
Absolutely. Oh, that'll be a blast.
Yeah.
Awesome.
So
well,
it'll be free. So hopefully everybody wants to join us. And we're also open for sponsorship opportunities for the Cannabis Science Fair. So if companies are interested, please definitely reach out. We would love to work with you on that.
Awesome. So my friends, if you are catching the replay, please leave a comment or a question. Marion, it's been an absolute pleasure. Emily and I were both looking forward
Thank
to
you
today.
so much, Marion.
Thank you.
Amazing. Thank you.
And
Thank
my
you.
friends, we will see you same time, same place next Thursday. And then I think we have a week off for Thanksgiving, which is crazy.
Yes.
But
Yes.
oh yeah, because we're not, I don't know about you, but I don't think we're doing scripting on Thanksgiving. Actually, it's Thursday.
No.
Take a break.
We'll take a break.
All right, my friends, have a great day. Thanks so much for stopping by. And again,
Thank you.
Emily, thank you. Marion, thank you. And for those of you that have questions about your medical cannabis certification, stop by medwellhealth.net. Also check out our event calendar and stop by and see Emily. She's very busy in the next 2 weeks and would love to chat with you and answer any questions you have. All right, my friends, have a great day and we will see you soon.